And I'm now going to move on to the next petition. It's a different subject. It's health. It's petition 660 of 2011 by Anna Spyra. She is here, and I will give her the floor to introduce her petition.
Szanowni członkowie Komisji Petycji.
Honourable members of the committee, honourable members of the European Parliament, this is my son, Oscar, and I'd like to thank you for this opportunity today to talk about my petition about standards in perinatal healthcare. I'd like to thank you for this opportunity to speak here today. I know that everybody is tired, but I'd like to speak on a very important subject. The most important thing for every new parent is the health of their child. But almost 18% of all newborns require oxygen supplementation. 10% is born prematurely. Around 2% of all newborns does not weigh more than 1,000 grams. This problem has been increasing. And the reason are older and older mothers, multiple births because of artificial insemination, infections, smoking and alcohol. Oscar, my son, is 13 years old now. He requires 24/7 care. He was born in a Polish hospital. He was premature. The standard of care was insufficient. There was a brain hemorrhage and mental retardation as a result. I am indeed very sad when I look at him. His situation is deteriorating, and I'm dreading what the future might bring. After I die, who's going to take care of him? That is why I have been fighting for better standards of care in perinatal healthcare in Poland and Europe. Every year, there are 500,000 of premature births, and I believe if we ensure in those very first minutes that the standard of care is sufficient, we might avoid many deaths. Lack of such professional standards results in disabilities, chronic diseases, epilepsy, speech disorders. This is a situation that impacts not only those vulnerable newborns, but also families, may result in depression, in diseases among parents, and results obviously in inefficiency at work. This impacts the economic situation of whole families, mothers not being able to work, and it has a financial impact of the whole family, but also higher costs in the whole European healthcare provision system. It has an impact on societies. These costs, if you allow, will be presented by Mrs. Mader, representing here the European Foundation for Preterm Babies and Newborns. I have to say with deep sadness that after 12 years, I still remember the traumatic experience of labour. If it hadn't been for the two relatives standing there beside me, I wouldn't even have known that after C-section my child wasn't breathing. His condition was very severe. When I think about it, I know that if the standard of care had been better, he might be a happier child now. We have to take care of Oscar 24/7, therefore obviously the situation of the whole family is very difficult. Many mothers are single mothers because of that. Many mothers are depressed, and as a mother like that, I would like you to turn your attention to this problem. There are many experts who have spoken on this issue. They have made some recommendations concerning perinatal care. However, these recommendations have not been translated into practice because there are no sufficient legal regulations. The European Society for Gynecology is planning to issue certain comprehensive guidelines concerning this, and only then, I believe, can every child receive the proper care. This should not depend on which hospital or which country a given child is born in. This is not only a Polish problem. I'd like to underline here that such actions are necessary in order for such standards to be introduced in all member states of the European Union. My wish would be that, thanks to pan-European perinatal standards, we can ensure good quality treatment so that all families have greater chance of happiness. Thank you very much for your attention. And I'm sorry for my speed, and I'm sorry for the length of my presentation. If I can ask now Silke Mader to take the floor, that would be great, because she could talk about the costs.
Thank you. They managed to translate your intervention. You have to take the floor too. Okay.
Sicherheitshalber spreche ich in meiner Sprache, weil doch die Nervosität.
Well, I'm going to be speaking my own language now that we've been listening to Polish. I do very much actively support Mrs. Spyra, and I've been doing this ever since the fact that she started her particular battle. I'm an affected mother as well, and we have the European Association for Premature Births and Young Babies, and we've got the benchmark report, and we've tried to set out just what the situation looks like in Europe and to issue certain recommendations. But ultimately, we do need your support in order to be able to implement certain matters. About 5 million children are born a year in Europe, and about 2 million, not of those 5 million, but another 2 million babies suffer and die. And there are a number of stillbirths, and 90,000 babies are born with severe mental disabilities, and 5,000 premature babies are born prematurely a day. And there's an enormous difference between 5.9% in Sweden and 11% in Austria, partly because we don't have any uniform registration of these kind of births and babies. And some of these children are registered as having been stillborn. And as I was saying, not all children are registered in the same way. It's very difficult for us to work on the basis of these figures. Every week, as of the 37th week of pregnancy, does make a considerable difference as to whether the child will die or not. And after the 37th week, as I said, there are certain factors which come into play as to whether there's a possibility for disability. And even in highly qualified centres, there is, well, we know there's perinatal care, and that perinatal care is provided by highly qualified staff. Ultimately, we know we have a brain, a heart, and a lung, and all of these organs are absolutely essential. And everything has to be done to allow these children to remain alive. But of course, health depends on the state of health of the baby when it's born. So here you have some figures. I do have the benchmark report with me here, and you can take a look at this for yourselves, and you can see a very clear difference between countries like Austria, Germany. We do rather badly when it comes to the number of premature babies. In the Nordic countries, where there's very good perinatal care, the figures are better, and there's a lot more done to awareness in order to keep the standards. So there is this difference then if you compare with other countries. And the causes for premature births, and perhaps this is why we have so few lobby groups for our children, where we know we're talking about alcohol, drugs, smoking. These are some of the causes of premature births. And if you look at most of the causes are also infections, lack of proper care during pregnancy, and not enough information being given to the pregnant mother. And this is why we would like to introduce European standards and an obligation to inform the patients. If you take a look at these kind of children, the babies who have these kind of complications, the complications in the case of premature babies or lack of oxygen at birth, as Mrs. Spyra has said, very severe mental disabilities, cerebral palsy, learning difficulties, and then there are chronic diseases. The lungs are not properly formed, other organs aren't either, and this means that later on the children suffer very serious chronic diseases, and this can all be proved on the basis of studies. And we know that in the case of 10% of all premature births, there's an enormous risk posed, and obviously that's a risk for the coming generations, coming society in the European Union. The brain develops itself precisely at that period when babies are born prematurely, and there are problems when it comes with their sight, with vision, pain, and this involves a lot of stress. And this does have an effect on the brain. And there are very many studies which show, we've got some of this information here, there are very many studies which show what happens if a baby is born prematurely and is not properly treated. And unfortunately, Mrs. Spyra has had to experience this for herself, as is the case for 500,000 babies that are born prematurely a year in the European Union. Not all of them are so severely disabled, but I think we are going to have to think in terms of trying to provide our children with better possibilities for survival. There are considerable differences in the European Union. This is a hospital in Eastern Europe where there aren't sufficient standards. The children are given oxygen, but there's no kind of control, any kind of monitoring, for example. So the oxygen is supplied on an estimated basis. Sometimes if there's not proper oxygen, the children go blind or suffer disabilities. And then, of course, light and noise is reduced in other hospitals in order, if there isn't a proper contact with the parents, there are problems as well. Now, there are illnesses and disease caused by this. We're talking about children that have a number of disabilities. I do apologise for speaking so fast. Yes, these are children who suffer from different disabilities, and obviously we're talking about long-term costs and finance, but there are learning problems for the not so severely disabled who are born prematurely. So problems, obviously, when it comes to getting educational qualifications or getting a jobs, and there's a social component here as well. And I have another study here which you can take a look at, a study which was commissioned in the United Kingdom, and this study shows that costs can be considerably reduced if the premature birth can be postponed by a week, so every day counts, as it were. And in an American study, it shows that we're not only talking about direct costs, but long-term costs, if you will. If you look at the first table, hospitalization, sending children back into hospitals for whatever reason, it increased to fourfold, and each of these bars shows just what it means in terms of extra cost if a child is born prematurely, before the 37th week, or but just prematurely. But then, of course, it's the families and society who experience this burden. As Mrs. Spyra has said, she herself can't work. There's a higher risk of divorce. And I myself, Mrs. Spyra, we've not had any more children after this first premature baby we've had. And this has implications for European society in the future if there are so many premature babies born. And this does have this long-term knock-on effect, especially if we're having to bear these costs, sort of health costs that are involved. If we take a look at the European standards, there's not only a duty and obligation for ourselves, there is a considerable risk for immigrants in our countries. They're more at risk of having premature babies. And we've already heard a petition about language. Well, we have problems in informing and helping some of these mothers. It shouldn't make any difference as to what country you live in or what kind of culture you live in, or whether you're a man or a woman in Europe. This is a risk, especially in the case of a premature birth with complications, if you can't be reanimated, resuscitated. My husband may have ended up alone had I not survived. And this is my son. This is one of my final. He's 15 years old. The tree behind the family photograph, this was actually planted on the grave of my daughter. I would have had a daughter today. I don't have a daughter because at the time she was born, there were not the right kind of perinatal standards. And so this is why we would very much hope that in the future we can have the right kind of standards for allowing us to have healthy children in Europe. Thank you.
Grazie.
Thank you. The Commission representative, please.
Può fare un intervento breve,
Please be brief.
Dankeschön, Frau Vorsitzende.
Thank you, Madam Chair.
Funktioniert sie?
Is the microphone working? I will be very brief. First of all, I would like to express my deep sympathy to Mrs. Spyra, because the situation she has described is indeed a very difficult one. But the Commission only has very limited legal possibilities in the area of health. It can make information available. And this is in fact done on a large scale. Mrs. Marta's organisation is involved actually in many Commission projects now, and makes large use of this information that we're able to provide. And this project and the information are made available to Member States, but it's the Member States who then have to make use of that information. The Commission has no influence over what Member States decide to do with that information. It is up to the Member States who have to implement that. And that's really all the Commission would like to say on this subject.
Grazie.
Thank you. Mr. Sonic.
Thank you, Chair. I would like to say that I greatly appreciate the efforts of Mrs. Spyra and Mrs. Mader. I appreciate their efforts and their actions aimed at introduction of such standards of perinatal care. I admire their devotion. I believe that it is indeed an obligation resting upon every country to introduce such standards. Now, a lot is said about the costs, and I'd like to ask Mrs. Spyra, do you believe that the financial issues are important here? I think somebody mentioned here that some savings, but how do you view this?
Walesa. No.
Dziękuję, Pani Przewodnicząca. Szanowni...
Thank you, Chair. The petition by Anna Spyra concerning pan-European perinatal standards is close to my heart. For a number of months now, I have been in touch with Mrs. Spyra and have been following these developments with great interest. And in my case, it was rather difficult. The problems covered in the petition are very important. What we're dealing here is lack of regulation or insufficient regulation in some member states concerning standards in healthcare, and ensuring the right facilities, sufficient facilities and procedures in labour vis-à-vis newborns and mothers. There are legal gaps in this, and therefore the result is the situation we're dealing here with here today. It is hard to say whether some actions taken by medical staff or whether the facilities are enough to ensure the safety of newborns. I believe such regulations, advocated by Mrs. Spyra, would create a point of reference and a benchmark. They could be a clear point of reference, especially when it comes to preterm babies. That is why I support Mrs. Spyra, and I believe that in the EU we should have some regulations concerning perinatal standards. We can't forget that every newly born citizen makes Europe stronger. And my question to Mrs. Spyra now to conclude: what should be the scope of such standards? What form should they take? And do you think they would make a difference? And if they had been in place in the past, would your son stand a greater chance of a better life? And a question to Mrs. Nader: what is your position? How do you view such standards in Europe? And I have two questions from my colleague, Lydia Göringer de Oedenberg, who couldn't be here today, unfortunately. She asked me to pose these two questions on her behalf. What possibilities do you see in terms of changing such standards? Do you think this is possible? And what kind of savings in terms of costs and family life?
Thank you. Nobody else wishes to speak, so I will give the floor to the Commissioner to reply.
Oczywiście.
Well, first of all, I'd like to thank for these questions. There's a number of them, but I try to be brief. Now, introduction of standards and legal regulations. All guidelines, all regulations, if they were now a normative act, a legal act, I think they would make it less likely that there is insufficient facilities, insufficient equipment, life-saving equipment. The European Commission said that the member states have the prerogatives here. But if we look at poor member states, would they agree to that? Because obviously we're talking here about equipment in hospitals. But can we allow for a situation where 10% of preterm babies, they require oxygen supplementation, they require incubators, and there is insufficient equipment in hospitals? These children, these newborns, these vulnerable newborns will look like my son does now. There was insufficient equipment in his case, and he wasn't breathing, although this very hospital should have possessed an incubator and oxygen supplementation equipment. There are situations where women just don't know where to go. They think about where there might be an incubator available if they know that they will deliver the baby prematurely. This is unacceptable. There are certain guidelines, but they are just recommendations. There are certain recommendations concerning the behavior of medical staff, but not equipment. This is left in the competences of the member states. But equipment is crucial. Parents like myself have to give up their jobs, and very often families just can't take this burden. There is a greater number of divorces. Who's going to take the blame? Who's going to maintain these families? Who's going to pay the costs? I think the EU should help such vulnerable parents. And we know that we're dealing with a very low birth rate in Europe. Parents don't want 2 or 3 children, but maybe it would be more cost efficient to ensure that there are certain standards in terms of safety, in terms of sufficient perinatal care. I'm not talking here about all the kinds of service and all kinds of procedures. This would be too difficult, but maybe supporting a pregnant woman as a client of healthcare services. She should be protected. She's the one that decides about the future of her child. We can do everything we can as mothers. We can take care of ourselves, but sometimes we just can't make it to the hospital. Sometimes we can't plan for 9 months. The labour might come earlier. We can't plan for everything. Thank you very much, and I'm sorry if I didn't answer all the questions. But obviously, it's not easy for me. Thank you.
Grazie, penso che...
Thank you. I think you've answered all the questions. Nevertheless, I think we have other questions in our minds, and I therefore think we should keep this petition open so that we can call on the Commission to approach this differently. We understand the limits of the different institutions' powers, but maybe we could take some initiative vis-à-vis local authorities, and at the same time we could ask the Commission to rejig the financial instruments it mentions in its communication. There are different ways of putting forward projects to the European Union in order to give better access to good health, and this might be a way of helping those countries who can't or find it difficult to adopt European standards, and from where we get these alarming reports. So we shouldn't be carried away by emotions, but at the same time, I think we should keep the committee's attention focused on this and do something in the two areas I've mentioned. So if nobody objects, we'll keep it open. We'll close the debate for today on this petition. So thank you to the petitioners, and we will keep in touch about the future progress of this petition. I'd like to move on now to the next item, which is